Okay, we've got an EXT of this guy here. I don't know if you can see that very well. We've got tooth number 3. We've got a root canal and a crown on that tooth, and that's going downhill. We've got a vertical root fracture on that, and we're going to do the EXT and bone graft today. Already got profound anesthesia on this tooth, and so we're going to walk our way through whilst I narrate. We've got bone graft materials in and soaking. We've pulled up full into the vial there, or the syringe there. We've got our 15 by 20 millimeter there, and then we've got our little juice over there. So, all right. Start with the Donatello here, or the Donatello. On the outside here, we're just going to raise where our flap is going to be. Does that feel sharp at all there, Russ?
Oh, yeah.
A little bit? Okay. Let's do a little bit more anesthetic here. Just want to reinforce that. That shouldn't be pinching at all. Sorry about that. Just do a little reinforcer of that guy.
Pepper also gives you the palate.
Okay, great. There you go. Okay. So for this tooth, because we got this flap all the way across, we're going to do most of the facial of tooth number 2. And we're going to go up high up to catch and block a little bit more. That PSA. And come up here to the medial as well. I'll just reinforce this panel over here. Looks like, yeah, I can see where that's already been placed. A little bit of pressure. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good job, Russ.
Good.
Little pinchers there.
Okay. Alright, so we're just going to separate those papillae there. A little bit of PDL loosening. Just going to lift right across here, full thickness on this guy. To raise that flap on the facial while the tooth is in. The lingual, we can raise it now or later. I'll just probably loosen it up just a little bit. Okay.
You okay there, Russ?
Okay, we've got crown on the tooth in front of it with a root canal, so I don't want to put much pressure on that one. So we're going to do just some very gentle pressure down here. Very gentle pressure, no pressure on this crown up here. A little wiggling, okay. Forceps, uppers. And I would expect the crown to separate off.
Lots of pressure, okay, Russ?
Flexing of this tooth. Okay, if you feel anything sharp, Russ, give me a little hand wave, okay?
Lots of pressure. Nice, slow breath. In and out through your nose. Good job.
Is that feeling sharp at all? No?
No?
Go ahead.
Just where that suction thing is poking.
Oh, okay. On this side over here?
No.
In the back.
Like
In the back
your-
over on here?
Down on the bottom.
Ah, okay. Okay. We'll try to keep off of that then. Okay. Relax down there. Good. I'm just doing a little bit of facial lingual rocking here. Not getting a whole lot of movement. That's okay. I'm going to go ahead and section this tooth.
Lots of water and vibration.
Let me get the crown off first.
Might hear some clicking.
Lots of vibration. Let me go get me a new handpiece. See if we got one that skips a little bit less. That handpiece seems to skip a lot. I don't know if that's the rotation or if we got an issue with the burr. I don't think it's a burr issue. I think that handpiece has a little bit of a weird skip to it. So. That guy really likes to skip around a lot. I'm going to minimize that with the angle here.
Great, lots of skipping.
Try a little bit of a different burr on that one. Try our skinny black diamond, see if that has a little bit less of that skipping. It's kind of...
Lots of water. Lots of pressure here, might get a little crack.
Coming off there. Gonna finish sectioning here. The goal is to section off the roots separate from each other if possible.
Lots of vibration from water.
So looking at the sectioning here, let's see all those segments. I'm going to switch to the mirror view here. Finish our sectioning of this area. So a nice good Y section across there. Now we're going to separate our segments here.
Put a little crack here.
Separate segments. Ideally, these will come out now just like individual incisors. Just individual roots.
Lots of pressure.
Also, for example, that mesial has space now to move into where the sectioning space is. Sometimes these come all nice and pretty, sometimes they want a little more sectioning.
Lots of pressure. Doing great, Rex. Nice, slow breath. And happy release.
The trick is to try not to force it. We want to kind of let them move the way they want to move to loosen up.
Lots of pressure. You're doing great, Russell. Nice, slow breath.
There's a nice little power root. He's wiggling pretty good, just not quite enough. Got our distal root there, and then our mesial. Our mesial is probably going to be the next easiest to remove. So we're going to flex him. Take our sweet time.
Doing great, Ross. Nice, slow breath.
Okay. Alright, we've got those 3 separate roots there, just the last little edges of them. Okay. So now we're going to work around them. Work to be able to move them inward. Root tip pick. Alright, so we moved a little bit more material around the mesial of that distal facial root. Put a little bit of a notch on the distal. Now we're just going to lift.
Lots of pressure.
Lift it up, nice and easy. Seeing some movement there. Okay, got that piece as well. Okay. Not enough reduction. A little more reduction.
Doing great, Russ. Nice slow breath. In and out.
As before, a little bit of lifting here. See if he wants to roll the other way.
Lots of pressure again. Nice slow breath in and out. Good job. You're doing great.
He doesn't want to move yet. We'll work back over here. The palatal. He's ready to move yet. Where did that? Oh, there it goes. Okay. All right. Come back to this guy here, a little bit more removal.
Doing great, Russ. Lots of pressure.
There's the palatal root. He's good. Thank you.
Lots of pressure. footing okay? That's good to do. Nothing sharp though? Okay, good.
A root tip left in that little sneaky disc line. Section. Go ahead and switch to the white section. We've got great strength of bone for when the implant's in there. Just not our favorite one that keeps these little root tips hanging out. So the goal is to continue to just remove a little bit of root structure around it. It does curve at a distal just a little bit, so remove a little bit more on the mesia here. Straight down in. Okay, got one piece there. Good. Section. You're doing great, you know.
So are you. You can start with more root tip.
Yeah, that last little millimeter, he's just hugging right up in there. Right up next to the sinus.
But you didn't want to play nice today.
Oh, we're just keeping it exciting, that's all.
True.
Keeping it interesting. Suction straight down in. Okay, straight down in again. Suction straight down in. Give me a new root tip pick, please. Let's take the slightly smaller one. I'll be able to get that guy out of there.
Unfortunately, it's not much smaller.
That's okay. Straight down on suction, yep. Okay. So section down through it a little bit more. Mesial distally. Put a little notch on the lingual here. Let's see if I can get that guy to rotate. A troublemaker.
He's just a little stubborn guy.
Yeah.
He's making things exciting. Apparently you don't have enough excitement today.
And that lingual piece loosened up, and there he goes, all out. Just had to do a little trash talking, that's all. Okay, right. Second root is out. He's a tricky, tricky little devil. Okay. A little bit of buccal plate separation there, but everything looks good. Nice dense. Okay. Coming over to the mesial facial now. Troughed on the mesial, or troughed on the distal, and then did a little insertion on that mesial to see if that'll flex out. They don't want to move either, do they? Okay. Alright, we're going to go ahead and section through that mesial distal. And turn back to the left a little bit there, Russ. Good. Yeah, just straight up and down. That's good. Thank you.
Hey, Angel.
Thank you. Okay, thanks.
Thank you.
Separate those two sections.
Doing great, Russ.
He is so close, but man, he does not want to come out.
Got a few fighters.
He's got a really dense bone, which is great for the final implant. It's not great for trying to take out the tooth.
Yeah.
So,
Just another yellow strip. Okay, thank you. Oh. That one. Let's move the pencil down. Lots of pressure.
there we go. Dink. Got him. Huzzah. Well, that was about much fun as I was hoping for, and then some.
And then some.
Okay. All right. Got them all out, all nice and clean. Everything's looking real good. Man, those were little fighters. All the way down to the tips of the bones. So, like I said, once we go to place the final implant in there, that bone will be perfect for us. Full thickness flap here on the window. Already done their flap on the facial here. So okay, we're going to irrigate really well. One more.
One more irrigate or?
One more irrigation, yep.
You took my cup.
Oh, I still, yeah, that's right. I'm like, what are you doing over there?
You can make do.
irrigate really well. Very good. Okay. All right, we're going to tuck in our membrane first. Very good. Okay. Bone graft, yep. Ready for that. A little bit left, hold that. Just want to pack the rest of that in here in just a second. Bit. Exit. Okay. Yep, the suture ready. Thank you. I'm just going to tuck that right underneath there. Nice and easy like. We want about a 3mm grab. Hold that. One, 2, 3, 4. Third position. I think that's a ballet term as well.
Ballet
Third position. Pretty sure that's a thing. Okay, hold that right there. Good. All right. Tuck this guy back down where we want him.
Doing great, Russ.
Three throws. And just medium tightness. Just enough to take out the slack. Not more than that.
You've got the scissors.
I've got the scissors. About 3 to 4 millimeters on the tails there. Okay, all right, I got our first one placed, looking good. Okay, tack down our second here. Reverse again.
Do you grab the membrane as you suture?
No, but you not particularly, but you can. It doesn't negatively affect how well it sits. So if I can grab it, then it kind of sticks in. I mean, I could grab it right there a little bit. That would be just fine.
Because grabbing the membrane kind of just helps it hold it in place. Right?
Yeah. It'll generally stay in place just fine without grabbing it though. There's enough when the blood clot and everything forms, it basically kind of holds everything in place, as long as the stitches hold things in place and things aren't moving around. So, okay, 1, 2, 3. Okay, let's take out any tension, nothing more than that. Want to keep all of our keratinized tissue. Okay, go ahead and trim that. About 4 millimeters up. A little lower, good. Put a little pressure here with the cotton. Hi, Russ, did great. Oh, the tricky one. Need some really dense bone around those roots. They did not want to come out, but we got them all out. Took us 50 minutes instead of 25, but that's all right. Some are easier than others. Okay, we'll take it.
Root canal tubes tend to be a little bit more.
Yep, they do. And it depends on where the fracture is at. It depends on how the tooth breaks and how the cookie crumbles, as they say. So, okay. All right, sir. Very little bleeding in this area. The stitches come out in 2 weeks. You will have a little bit of bleeding that trickles over the next few days on and off because of the Eliquis, and that's okay. Don't worry about that. That will slow down and stop. If you get a little bit of bleeding that lasts a little bit longer than that, go ahead and put a little tea bag right up here and go ahead and I'll have you bite on this here just to hold this for just about 10 minutes or so. Go ahead and bite down on that cotton there. Good. All right. You don't have to bite hard. Just hold it, kind of hold it in place a little bit. Just a little bit of pressure there. All right, that'll do it.